From a personalized medicine point of view, do you have any thoughts on companies that specialize in analyzing genetic testing relating to CBD, THC, such as Endocanna Health?
I'm not familiar with that. It could be beneficial on a certain level. The main thing is that when we look at so here's a positive and negative about genetic testing. So people, even people who just get, say, 23andMe or whatever, getting, is that the genetic expressions are expressions. They're not fixed. So epigenetically, we change that. So, for example, in our patients, so that's when we have, so even with, I'll just give you an example, with methylation issues. So people are like, oh, I'm all these MTHFR issues, or even if they're getting a lipid profile, oh, I'm ApoA, ApoB, and I have all these things. And we thought they were genetic and they were stuck and they were fixed, and you're going to have this problem. This is how you metabolize, whatever. Within 3 months, whole food plant-based diet, eliminate their food allergies, fix the microbiome, upregulate immune system, which there are certain things that people can get. We talk about in my book and everything else like that. Some of these things are also using, the hemp oil as well, is that those expressions change. And most people have never seen that because we've only tested once and we said, okay, you have it for life and you're gone. So it could be helpful. I don't think it's going to be as tailored, because if they change, remember, that's why the individualism is like, yeah, we can say, is this way or that way? And sometimes it might say, maybe start a lesser dose, or maybe don't take the full spectrum, or maybe you need this or that. However, I wouldn't be fixed to that, because the body's a little bit more complex. That's kind of using like functional and genetic genomics, but now we know like nutrigenomics, metabolic genomics, and the gut genomics. That's also changing the expression of some of those genes as well. So it could be helpful. I haven't looked at that, so I'll definitely take a look. Maybe we can talk later and I can take a look at that.
Okay, then Tracy is asking, I use CBDA and CBD. I've read about the differences, but what do you have to say about it?
So, one's more of the acidic form, more of the raw form. I'll say that for a different lecture. I'll come back, but we can talk about the different forms of CBD and, more importantly, the terpene profiles. Everybody's going to have a spin on it. So what I'm always looking for right now, I think just in general, just because patients will get everything, you'll recommend something in your office, they'll use it, and then they'll go to the store and get something, or the chiropractor, massage therapist, the other doctor, the health market will have something. So I'm always first, before we talk about even those things, I'm always like, you have to see a certificate of analysis and you have to look at it. And I think what we'll do next time, if you want, it might be a CME or not CME, but it's like, really, how do you read a certificate of analysis? Because I'm in the nutraceutical world. I consult for a lot of companies. We do clinical trials for nutraceuticals for drug, like for hospitals and research studies and stuff like that. So when we look at profiles, like, we can't have traces of anything. I can't have any part of a pesticide, herbicide, even though like for other things they don't test it. But when it comes to natural things, we have this like extra bar that we have to reach to do things to improve. And so I would always make sure that, can you learn how to read a certificate analysis? Because everybody on the internet will say it's third-party tested. Third-party tested means nothing in America. And in fact, of the major big players, in the last 8 years, because I consulted for almost half of them or more of them, believe it or not. Some of them were better than other companies. Like, all I can do is just provide information as a physician, evidence-based. What they do with their marketing and what they do with their business operations are different. But what we see is that most of these companies where they have a third-party testing, that third-party testing is a sub-company of themselves. Okay, so especially in the last 5 years, there's all these big players, and they go, here's my certificate. They show me a certificate, and if I Google like the business, and the DBA and all this stuff, who is it? It's a sub company of them. They hire this high school student who's got a chemistry, little machine and all. There's some companies that we recommend, that I recommend, that we just, the reason being is because when we say third party, we're not even talking about a CBD testing. We're looking at, is there what they call, there's forensics laboratories now that they test. That's why it's like all these hundreds of other compounds. It's not just CBD, because anybody that's just testing CBD, they're only looking at what else, like, what am I looking for? Okay, that's important. We all need to have that. However, what is all these other things that we want to make sure that it doesn't have? And the reason why we have to scrutinize it, because since there is the synthetic adulterants that are easily now affordable off the internet, they're easily getting in China and India, which we manufactured things super cheap now. And that's why you can look, literally, you can see things that are a tenth. You can buy something, say maybe $70 to $200 a bottle, and you can see things like a half a gallon or something for like so cheap. Like, how is someone selling this on Facebook, on Instagram? I would be really cautious to see that actually will pass testing.
Okay, then Vivica has a question. Hepatic impairment risk or only if used with cloabazam valproate?
If patient has elevated liver enzymes, AST, ALT, alkaline phosphatase issues, then like every drug, it will metabolize a little bit slower or have. So I would definitely start off with a lower dose, and then I would definitely avoid using the full spectrum because they're just going to have a little bit more THC, and if they're sensitive, then they would have that more of an issue. But still, I would always start off lower. Fatty liver patients too. Now, 40% of Americans have fatty liver. Now, if they have fatty liver, the enzymes might not be elevated, but if the enzymes are elevated, that already means that 60% of the liver has insult when any AST, ALT, alkaline phos is elevated. That's how the test is regulated. So you want to make sure on those patients, on any drug, even on any of the herbs, you always start lower because they have more potential of even having a side effect of even something that works wonderfully because it can just not make them feel well.
Cassandra has a question about CBD for pets. So do you prefer broad, isolate, or full spectrum CBD for humans?
I only use broad for pets, believe it or not. I know that there's a lot of vets that will say, hey, you need a little trace because if they're actually in pain. But I'm not really sure how dogs metabolize the THC as much. We know that they have their own endocannabinoid system. So we know that it's just, they're producing the anandamide kind of thing, 2AG similarly. And so we've, I'm not a vet, but we have a lot of patients that come in and it's like we recommend it. It works great in animals. They just have to dose it very carefully because they don't need too much. And usually on the internet you'll go to certain vet sites and they'll give a dosage because they kind of base it on weight. But you'll find that the dogs, especially dogs and horses, as the patients that I see is dogs and horses, they have great results with that. And because again, the drugs that they give conventionally for us, they give for pets, just with a different name. And so it's the same thing. Like, here's your arthritic drug. Well, here's a arthritic drug, or here's a diabetes drug. Here's a diabetes drug for your dog. If you get to something, it's great. The idea is that the THC, I don't want to confuse because some of the animals, based on their size, their metabolism might be different. So I just look at broad spectrum only for pets for me because I'm just like, pets are like my family, so I would never want to, and family's like my family, so I just don't want to have any problems with anybody. And remember, just one thing, the THC is not a problem. Like, with our cancer patients, we use THC, we use cannabis all the time from dispensaries. If they got bone pain, if they have cachexia, if they have nausea and vomiting from chemotherapy, THC can be very helpful. But a lot of, the industry has spun in the last 10 years this kind of concept, like it's the magic, it's the key avenger of the whole super group. And it's not true. That's what causes people to have higher, the license or the cachet of like, oh, it's this or that. And in fact, I'll just give a little story here real quick, is that when in the last conference I was at that was in Portland, there's a group there, a scientist. She's been studying cannabis for about 20 years, and they're looking at the CBD profiles, right? And then looking at the profiles of like when people go to dispensary, and they go to dispensaries, and everybody's, I don't know if you've been to dispensary, half of you may have, half of you may not have. It's like going to Starbucks the first time, and like all you want is coffee, and there's like 500 things that don't say coffee on it. You're like, I don't know what a Venti Grande latte is. I just want coffee. So same thing when people go to dispensary. If you ever have a chance to go inside, they have all these different, indica sativa and the mountain this and purple kush and ACDC and sour tsunami and banana this and people don't know what that means. So they're just different parts of the different strains of the plant that have different profiles. Interesting thing is everybody will say, I need this for my sleep. I need this one. This is the strain that I need. And they're so stuck to it. And now when they actually look at the studies and they take 40 of the most common strains, there's only 2 strains that showed outside the kind of the plot of the curve that actually has its own different profile. Everything else pretty much aggregates because they've bred this plant so much. I'm talking about the cannabis plant, not the hemp plant is just the same. It'll never change. It's 0.3% or less, and then they can remove it to make the broad spectrum. But on the cannabis plant, they've bred it because everybody wants, I want a little bit of this terpene, I want a little bit of this high, I want a little bit of the excitement, I want a little bit of this, flavor and this feeling. So they all are roughly the same. So in fact, when you go to a dispensary, even though they have 100 choices, it's really almost the same product. It's now all the cell. It's the name. Do you like, Magic Mountain or do you like Magic Mike? I don't know. So although in the 60s it used to be actually different. They'd have a little bit more things, and so there is a few strains actually plotted outside the curve. Interesting though, it's really more the cell. Again, not that anything's wrong, just means that it's not as like, oh, you need to have this or else. Everybody will say this in every dispensary to even compete against dispensaries. It's not true.
Okay, we got a few minutes left. Gosh, I've got 2 questions here. So one is any effect on thyroid issues.
Positively, yes. So not just so I have not seen anything with just hypothyroidism, okay, but with the Hashimoto's disease, which we know is inflammation of your thyroiditis, right? The inflammation of the thyroid, it does help with that. And so again, especially when they're in a Hashimoto flare and the TPO antibodies are greater than 1,000, which I saw 2 people this week with greater than 1,000 already. So they're in a flare. So even though their TSH and their free T3, T4 might be in the normal range or even the optimal functional range, they feel horrible because their symptoms is all over the place, right? Because although that's capturing in time when the TPO antibodies they're flaring, it has this ability to help with. Remember, it's repairing. It's looking at what is that overacting. Can it help calm that down? There's other herbs in herbal medicine that is used as well, and you also have to look at other cofactors and also like other inflammatories to help. Because remember, I look at it as a whole barrage of like that thyroid's flaring. So we have to look at what are the triggering factors that make inflammation of the body, remove those things, and help the body support its natural healing state. So yes, it can be helpful for, I think, more for the Hashimoto's. Hypothyroid, I haven't really seen because I get more hypothyroid patients than Hashimoto's. I don't see a huge change. On other parts of the hypothyroid patient, I do see improvement, but not necessarily of just changing their numbers.
Okay, one more question. Can it help with muscle wasting diseases, inclusion body myositis? Oops, I just moved.
Myositis, yes, because remember, it's an inflammatory response. And remember, the CB2 receptors are in the muscles. So, I would say it would definitely be worth a try. And start and so those people, because they're actually having some kind of severe issue, then again it'd be starting on a lower dose rather than a higher dose. Even though some people are like, oh, they're having such a major problem, it's like, no, you might overshoot the receptors and not have that response. So they again, like the rheumatoid patient, might start lower and then but give some time, because remember, we're talking about repairing the tissue. So don't expect they take it in 5 days later they're like, oh, my muscle pain is gone. But they should definitely start saying that I feel better. Even the things that you give. So remember, vitamin D, anti-inflammatories, all these other natural anti-inflammatories, Chinese herbs that you give all the time, right? How do we make the body utilize those things? That's what the CBD. So I always look at it as an adjunctive therapy that's just helping other therapies work better. Aside of its own repairing mechanisms, how can it work with other things to make it synergistic? So I would definitely use that.